Before we begin, can I remind members that social distancing measures are in place in the Chamber and across the Holyrood campus, and ask that members take care to observe these measures over the course of this afternoon's business, including when entering and exiting the Chamber. The first item of business is portfolio questions. May I remind members, if they wish to ask a supplementary, to press the request to speak button or enter R in the chat function if online. And can we begin with question number 1, Jackie Bailey.
To ask the Scottish Government what plans it has to provide the outdoor learning and youth work sector with the financial support required to prevent the permanent closure of outdoor residential centres. Minister Richard Lochhead.
Since the initial closure of schools, the Scottish Government has worked closely with the Scottish Advisory Panel for Outdoor Education to support the appropriate use of outdoor education centres during the pandemic and to highlight the valuable contribution played by centres across Scotland. Earlier this year, third sector organisations that run outdoor education were able to apply for support through our £25 million Third Sector Resilience Fund. In addition, centres could also apply for a 0% interest loan starting at £50,000 via Social Investment Scotland, and outdoor youth work is listed as a key objective in the newly created £3 million Youth Work Education Recovery Fund, which was announced in mid-September, and funding awards of £20,000 to £60,000 are available through that fund. And finally, a number of third sector outdoor centres may be eligible to apply for funding under the forthcoming Community and Third Sector Recovery Programme.
Jackie Bailey.
Can I thank the Minister for that response? And of course, he'll be aware from the debate last night that outdoor education centres in my constituency and across Scotland are facing severe financial hardship, and many face closure and substantial loss of jobs within a matter of weeks. Whilst guidance on day trips is helpful, it's insufficient to sustain the centres, and they are not eligible for at least the Third Sector Resilience Fund and have difficulty accessing some of the other funds he's described. So can I ask the Minister to meet with representatives of outdoor education centres urgently to arrange for funding to avoid closure?
Richard Lochhead.
As the member says, last night's debate highlighted the importance that members across the Chamber attach to the very valuable role carried out by outdoor education centres in Scotland, delivering really valuable skills for Scotland's young people. And in that debate, I did give a commitment to the Chamber that ministers will engage with the sector in the coming days. We very much appreciate the incredible challenges they face as a result of the global pandemic that is affecting all sectors of society. And we are listening very closely to what they're saying, and we recognise the valuable role they're playing. So we will be engaging with them in the coming days, and also local authorities in Scotland and Directors of Education. A big role here for local authorities to play. They engage with outdoor centres.
Question number 2, Alex Cole-Hamilton.
Thank you, Presiding Officer. To ask the Scottish Government what additional measures it is considering to support pupils and teachers who were shielding before the return to school.
Cabinet Secretary John Swinney.
Presiding Officer, the guidance which was prepared to support planning for the return to school sets out the particular considerations for children, young people and staff for whom special considerations are required. The guidance is clear that whilst the requirement to shield is currently not in place, those who are clinically vulnerable or extremely clinically vulnerable were able to return to school and work unless they were advised not to by their GP or healthcare provider. The guidance also sets out the need to continue to monitor and review these matters and to plan ahead for any potential localised outbreak.
Alex Cole-Hamilton.
I'm very grateful to the Cabinet Secretary for that reply. The Cabinet Secretary will be aware that there are hundreds of teachers and thousands of school pupils who were either shielding or living with somebody who was shielding, and they will all be feeling understandably particularly exposed as we move into a partial lockdown. On this, the day that Scotland recorded its highest ever daily incidence of coronavirus infections, can he advise the Chamber as to what the tipping point is in terms of community transmission, at which he feels that it will no longer be safe for these students and their teachers to remain on school, and what additional measures is he planning to protect them?
Cabinet Secretary.
Presiding Officer, the emphasis in my first answer on the guidance that has been published is designed to assure Mr Cole-Hamilton and those on whose behalf he advocates that the guidance assumes that there is specific consideration given to the circumstances of any individual who faces any form of clinical challenge and who therefore may have been shielding in the previous arrangements. Those approaches should be pursued by individual schools with the support of local authorities to make sure the needs of staff or pupils are met. In relation to the additional point that he's raised in his supplementary question, obviously we listen very carefully to the advice of our clinicians, the work also of the National Incident Management Team to provide us with guidance on what are the appropriate steps that we need to take in relation to any localised outbreaks that take place. And of course the Government has taken a number of these steps in relation to particular situations in Aberdeen, the west of Scotland, Dumfries and Galloway, and of course yesterday we announced more widespread changes to the arrangements that are in place.
Very much. Question number 3, Maurice Golden.
Thank you, Deputy Presiding Officer. To ask the Scottish Government what analysis it has undertaken of the impact of COVID-19 on the attainment gap.
Cabinet Secretary John Swinney.
Presiding Officer, I have committed to the implementation of an equity audit to deepen our understanding of the impact of COVID-19 on children from disadvantaged backgrounds and set clear areas of focus for accelerating recovery. Work on the equity audit has commenced and will report in full in December. It will include a synthesis of key literature and be supplemented with local evidence gathered from schools and other children's services. It is an important part of the recovery process and will inform future policy and practice.
Maurice Golden.
I thank the Cabinet Secretary for that answer. The SNP pledged to set up a digital schools network in 2007, but almost two-thirds of young people had no online teacher contact during lockdown. After 13 years, why couldn't the SNP get the most vulnerable pupils online?
Cabinet Secretary.
Well, I think Mr Golden is well and truly mistaken in his analysis. The Government has established the Digital Schools Network. We have the GLOW system in place. Usage of the GLOW system has increased exponentially during lockdown. And obviously the Government has supplemented that by providing 25,000 devices and connectivity packages where that's appropriate to schools around the country. In addition to that, local authorities who carry the statutory duty for the delivery of education have undertaken significant work to deliver devices to young people who didn't have access to them. And indeed this morning, in a column which I was involved with head teachers, I was hearing of some of the positive benefits of exactly that work. So I suggest to Mr Golden that he looks more widely at some of the issues and the progress that's been made on this important topic.
Ian Gray.
Thank you. One impact of COVID-19 which may affect attainment and the attainment gap is the need for young people to socially isolate, not just in schools but in universities too, where we've seen hundreds of students in recent days being asked to socially isolate. How will the Government respond to that issue?
Cabinet Secretary.
I think the most important response is in two parts. One is in relation to supporting individuals to self-isolate and by putting in place the support arrangements to do that. And of course, through the resilience work that we have in place, working through local resilience partnerships, there is practical support available to individuals who have to self-isolate. And of course, we confirmed yesterday that in the context of supporting incomes, there would be £500 payments available to individuals who have to self-isolate. And then secondly, in relation to the curricular and digital support to individuals, where obviously I've rehearsed with Mr Golden some of the practical steps that have been taken in terms of digital rollout, but obviously schools have been encouraged to develop the models for the delivery of online learning should there be disruption to learning, and schools have those plans in place.
Question number 4, Bill Kidd.
Thank you, Presiding Officer. To ask the Scottish Government what the procedure and timescale is for probationary teachers to secure posts in schools.
Cabinet Secretary.
Presiding Officer, I recently announced £80 million of additional investment in education staff. While the recruitment and deployment of teachers are matters for local authorities, our workforce planning guidance makes clear that recruitment of existing qualified staff should be prioritised. That includes all qualified teachers currently seeking work, including post-probationer teachers and recently qualified teachers. Local authorities are continuing to work through their recruitment processes, and current COSLA estimates suggest that an additional 1,118 teachers have already been recruited, with plans in place to recruit another 250.
Bill Kidd.
I thank the Cabinet Secretary for that reply. One of my constituents completed and passed her probationary teaching period earlier this year, but she so far failed to be able to find any secure temporary or permanent teaching post. What advice can the Minister, Cabinet Secretary, offer for people in her situation to move her position forward?
Cabinet Secretary.
Presiding Officer, as I indicated in my earlier answer to Mr Kidd, there is an ongoing recruitment process being undertaken by local authorities with the additional resources that the Government has put in place. So I would encourage Mr Kidd's constituent to pursue relevant local authorities for individual posts. There are recruitment adverts that are available indicating that situation. It may not be possible for post-probation teachers to secure employment in the local authority where they undertook their induction placement, but I would encourage Mr Kidd's constituent to make those contacts with the relevant local authorities who have advertised teaching posts to try to secure such an opportunity.
Jamie Green.
Thank you. The Cabinet Secretary will be aware from comments from the EIS that during the summer there were thousands of NQTs desperate for work. Whilst we can point towards local authorities for numbers, does the Cabinet Secretary himself know how many newly qualified teachers have been given full-time teaching contracts this summer? And what plans does the Government have to use these teachers to alleviate COVID-related pressures in teaching?
Cabinet Secretary. I think there's a number of points in there. It's a matter of routine form on an annual basis that a sizable number of newly qualified teachers secure employment as part of the annual recruitment of local authorities to replenish the teaching profession. The Government has, of course, added to that by the provision of the £75 million for the recruitment of additional teachers. And we are working with local authorities to ensure that those resources are delivered effectively around the country. Now, the recruitment process is not completed. I have made clear to Parliament that over 1,100 teachers have been recruited. They will be substantially from the grouping of newly qualified teachers to which I have referred, and some recently qualified teachers into the bargain. And the employment position and the numbers will become clear once that recruitment process is completed. Question number 5, Murdo Fraser.
Thank you, Deputy Presiding Officer. To ask the Scottish Government what measures it has put in place in schools to reinforce the message that pupils need to adhere to social distancing guidelines. Cabinet Secretary John Swinney.
Presiding Officer, our guidance makes clear that 2-metre distancing between adults and pupils should be observed wherever possible. The Scottish Government has worked with partners to develop materials such as the Sector Advice Card for schools to support understanding of the guidance. However, it is not possible for national guidance to address the very varied and particular circumstances of individual schools, settings and pupils. Local authorities are best placed to identify how to meet the needs of the children and young people in their local area and to design their school environments accordingly. Murdo Fraser.
I thank the Cabinet Secretary for his response. A recent survey by the NAS UWT union found out that only 6% of teachers working in schools in Glasgow said that school managers were reinforcing messages on the need for pupils to keep apart. Given this will be causing a great deal of concern to those in the teaching profession, does the Cabinet Secretary recognise how serious an issue this is? And what more can the Scottish Government do to support local authorities to reinforce these messages to pupils?
Cabinet Secretary. Presiding Officer, the Education Recovery Group devised the guidance, which includes a number of mitigations to ensure that our schools are safe. And one of those mitigations is the approach in relation to physical distancing. The Education Recovery Group monitors that guidance, and indeed tomorrow at our weekly meeting we will reflect on the implementation of the guidance at local level and identify what further steps can and should be taken to enforce mitigation. Schools have, of course, taken a number of different routes. There have been timetable changes that have been put in place, for example, to reduce the movement that goes on within the school day. There are enhanced cleaning arrangements, there are different routing arrangements, different entrances being used in individual schools. And, of course, the Government has strengthened the guidance by putting in place the requirement for face coverings to be used by all pupils and staff in communal areas. So this is an issue which will be the subject of continuous review by the Education Recovery on a weekly basis to ensure that we maintain the high levels of safety that are prevalent in our schools today.
Question number 6, Liam Kerr.
Thank you, Presiding Officer. To ask the Scottish Government what progress it has made with its commitment to recruit 850 extra teachers and around 200 additional support staff to help schools deal with the pressures arising from their reopening following the lockdown.
Cabinet Secretary John Swinney.
Presiding Officer, I recently announced £80 million of additional investment in education staff, sufficient for local authorities to recruit around 1,400 additional teachers and 200 support staff this year. While local authorities are still working through their recruitment processes, current COSLA estimates suggest that an additional 1,118 teachers have already been recruited, with plans in place to recruit another 250.
Liam Kerr.
I thank the Cabinet Secretary for that answer. Now, for full transparency, I remind the Chamber I'm married to an Aberdeen teacher. I listened to the previous answer to Murdo Fraser. Now, the Scottish Government guidance asks schools to enable social distancing where staffing within the school allows it. 83% of Aberdeen-based EIS members report no reductions in class sizes. Aberdeen Council says its schools need twice as many staff to make this happen, and the local union secretary states the money has to come from the Scottish Government. So will the Cabinet Secretary provide the money required to allow Aberdeen schools to do as the Scottish Government requires, or will he leave teachers and pupils at risk from the virus and schools at risk of closing?
Cabinet Secretary.
I think Mr Kerr gets more and more reckless with his language every time I hear him speak, because our schools are safe today, and it does nobody any service whatsoever for a Member of Parliament to come to Parliament and to say things of the recklessness of Mr Kerr's remarks about the safety of our schools. We put in place guidance to ensure that our schools could be safe. They have returned on a safe basis. They have sustained their operations on a safe basis. And instead of coming here, scaremongering as Mr Kerr has done, I suggest Mr Kerr looks at the evidence.
Claire Adamson. Call Claire Adamson. I fear we may not be able to hear from Claire Adamson this afternoon. Question number 7, Joanne Lamont.
Thank you. To ask the Scottish Government what support it has provided to disabled children and young people during the COVID-19 pandemic.
Minister Marie Todd.
Presiding Officer, we recognise that disabled children and young people and their families may be finding this difficult time particularly challenging. As we work through the phases of recovery from COVID-19, it's essential that we continue to support and safeguard the well-being of all children and families. Throughout the pandemic, we've worked to ensure that disabled children and young people can continue, where appropriate, to access education or childcare settings, to secure continuity in their care and support, and to access social care with minimal disruption. Funding has been provided to support organisations and charities through a number of funding initiatives, as well as through continuing core grant funding. Support for unpaid carers has also been improved by implementing the Coronavirus Carers Allowance Supplement. We've also opened a number of digital inclusion projects to mitigate against isolation and to improve access to services, particularly for those who have been shielding.
Joanne Lamont.
Thank you. We all know that the pandemic has made an already challenging situation for many families across Scotland even worse. And for all too many disabled young people, moving on into further or higher education or finding work or training can be an insurmountable challenge. Parents across Scotland have told me they need legislation and a statutory right to a transition plan now more than ever. The current system is simply not working. At the end of this month, I shall introduce a transitions bill to help young people meet the challenges of adult life, and I'm delighted that it has secured support from MSPs across the Chamber. Will the Minister agree to work with me, parents and disabled young people to ensure my proposal, guaranteeing the support they so clearly need, is introduced this parliamentary term?
Minister Marie Todd.
So I certainly am more than willing to work with the member to ensure that the needs are met. There's already a lot of published policy and legislation in this area, but the lived experience of children and young people is undoubtedly still inconsistent. And I think all of us across the chamber would agree with that. So I'm keen to work together towards solutions. The member will be aware, however, that until I see the bill and examine the detail of the bill, I can't give you a guarantee of government support on that. And the member will also be aware that the government have had to shelve plans for our own legislation over the next period because of the pressures related to the pandemic. Despite that, however, we are very focused on work in this area, and we have a work plan which focuses on improving frontline practice and has a number of strands. And also, I do expect the incorporation of the UNCRC bill to provide some transformation in this landscape, with children's rights being justiciable in future.
We haven't been able to get Claire Adamson back again. Question 8 was withdrawn, so that concludes the portfolio questions on education, and we'll move on to portfolio questions on health and sport. Question number 1, Bob Doris.
Thank you, Presiding Officer. To ask the Scottish Government what progress it has made on ensuring that a range of treatment options are available for people living with addiction.
Joe Fitzpatrick.
Good progress has been made locally and nationally to ensure that a range of treatment options are available for people in need of support. Locally, services are already responding to Scotland's 8-point plan for the establishment of a recovery-orientated system of care around alcohol and drugs. This 8-point plan, which comes from the Rights, Respect and Recovery strategy, includes an emphasis on the need for a full range of treatment options to be available locally. At a national level, we have developed quality principles for alcohol and drug services, which set out what people can expect when they access an alcohol or drug treatment service. Alongside this, the Drugs Death Task Force is currently establishing standards for delivery of opiate substitute therapy. There is now a growing range of opiate substitute treatment options emerging, including long-acting alternatives such as Buvidal. In response to the COVID pandemic, we made £1.9 million available to improve access to Buvidal in prison settings and are developing plans to support further rollout of these alternatives across the wider community.
Bob Doris.
I thank the Minister for that answer, and I'm pleased that the Minister agrees with me that a range of treatment pathways are absolutely crucial. On that front, I'm pleased that he'll be meeting with Cisco in my constituency soon, who offer support for those in recovery within the communities I serve. However, the Minister knows my ongoing wish to see additional capacity in residential rehabilitation. Can the Minister update me on residential rehabilitation capacity and any ongoing work to develop treatment pathways for residential rehab?
Joe Fitzpatrick.
Thank the member for his question, and I look forward to joining him with the meeting and to hear about that organisation's work. Because I do think it is very important that we have a range of support, some of which is coming directly from our public services, but I do not underestimate the importance of third sector organisations, particularly those which are based on lived and living experience. Our strategy includes a clear commitment to better understand the needs for residential services across Scotland and to develop effective services to meet those needs. We've started work to establish, to map out existing pathways of rehab, access current funding models and scope out the overall demand for services in order to give a better understanding of the number and type of residential beds required. We are also working with a range of partners to improve the pathways from prison to residential rehab as an enhanced service to support people's recovery at this time, and that was something we were able to accelerate during COVID. We have also asked David McCartney of LEAP to lead a working group looking at how we can take those options forward in order to make sure that we have appropriate not just appropriate rehabilitation services, but appropriate access to those services on an informed and evidence-based basis right across Scotland.
Short supplementary questions and answers, please, from Brian Whittle, followed by Monica Lennon.
Thank you, Deputy Presiding Officer. During lockdown, Minister, you'll be aware the third sector has been invaluable in maintaining contact with the most vulnerable in our communities who are suffering with addiction. So can I ask the Minister how the Scottish Government plans to ensure the third sector is appropriately supported to maintain their services throughout the COVID-19 crisis and beyond?
Joe Fitzpatrick.
I have certainly prior to COVID spent a huge amount of time visiting many of the sorts of organisations, third sector organisations that Mr Whittle talks about, in which Mr Doris mentioned in his earlier question. Throughout COVID, we have provided extra funding, and there's an additional £20 million within the system. There's also additional money that's being routed through the Drug Death Task Force for a range of options, and some of that is committed and some of it is going through the grants process. But Mr Whittle can be absolutely assured from all the personal contacts that I have done that I do not underestimate the huge value and contribution of third sector partners, and I think it's particularly strongest when in places like Lanarkshire, where the third sector is working hand in hand with the public sector.
Monica Lennon.
Thank you, Presiding Officer. Scotland's drug death emergency isn't easing, so can I ask the Minister how many people have been referred to residential rehab during the pandemic, how many places are currently available, and how much of the task force's money has been spent on rehab in the last year?
Joe Fitzpatrick.
So the Drug Death Task Force is focusing on a range of work, specifically in relation to rehab. Sorry, actually, I'm going to wind back a bit, because I think at the first point we have to remember that in terms of this really difficult, long-standing problem, there is no one single silver bullet. So I think it's really important that when we're talking about rehab, or talking about Buvidal, or talking about anything else, that we remember that that it's the range of options that's really important. And it almost sounds like there's a suggestion that if we just spent all our money on rehab, then the problem would go away, and that is clearly not important. Not the fact. However, the Drug Death Task Force are currently working on establishing a test of change to look at how an offer can be made in relation to residential rehab as part of a longer recovery journey, particularly for those people who have experienced a non-fatal drug overdose, to try and protect them in the next stages. But as I said into my answer to Mr Doris, there's another short-term working group led by Mr David McCartney from Edinburgh Abstinence Project, which is looking at what more we can do to open up those routes into rehabilitation for those people who it is appropriate.
Question number 2, Maureen Watt.
Thank you, Presiding Officer. To ask the Scottish Government what steps it's taking to reassure people in the North East and elsewhere that signing up to the Protect Scotland app does not make them more at risk of scamming.
Jean Freeman.
There is no increased risk of exposure to scamming by downloading the Protect Scotland app. The app doesn't collect your name, address or age and does not hold your phone number. The app cannot track your location and cannot reveal the identities of anyone you have been in contact with or who has tested positive. There is no information on the app that a scammer can use to try to access your identity. Phone calls or texts from genuine NHS Scotland contact tracers will always come from this number, 0800 030 8012. Callers will always introduce themselves and the reason for their call, and they will never ask for your computer passwords or your bank details. The app is an important additional tool to our NHS Test and Protect system. It helps with contact tracing, particularly in circumstances where you will not know the name or any of the details of someone that you have been in close contact with, for example, in a shop or in public transport.
Maureen Watt.
I thank the Minister for that full reply. Ensuring people have confidence in the safety of the Protect app will, I hope, increase uptake of the app. For it to be its most effective, we do need people to download it. The Government has previously written to the people of Scotland regarding the pandemic. In the light of yesterday's announcement, do they plan to do so again? And if that is the case, will they be including in the letter details of the Protect Scotland app and the means of downloading it, such as the QR code?
Jean Freeman.
Yes, work is already underway for a further national door drop during November, covering a range of topics with respect to the health service, and that will include information on the Test and Protect service and why it is important to download the Protect Scotland app with those additional reassurances, which are in the app if you can download it and you can see them, but with those additional reassurances for those who have not yet done so.
Question number 3, Alison Johnson.
Thank you. To ask the Scottish Government what its response is to Commonweal's paper Warning Lights, 10 Actions for COVID Elimination.
Jean Freeman.
We welcome Commonweal's publication, and indeed many of the recommendations in its report we already have in place. Our own approach and principles which guide us as we take decisions are in our COVID-19 framework for decision making. Scotland has a tried and tested approach to managing outbreaks of any infection in Scotland, and we continue to work closely with local incident management teams who are critical in this work as we respond to the outbreaks of COVID-19.
Alison Johnson.
Thank you. The paper does indeed propose a decentralised strategy, and the paper states it's simply not credible to believe that an elimination strategy can be delivered if there's no monitoring of routes of new infection entering the country. It recommends measures to prevent incoming infection, including diverting people arriving in Scotland's airports through testing stations and requiring inbound travellers to isolate in a secure location such as a hotel to ensure compliance with quarantine rules. So can I ask if the Cabinet Secretary is considering such measures?
Jean Freeman.
So we have never said that we have complete control over the elimination strategy that we are pursuing, because we do not control our own borders. We've had this debate and discussion about testing at airports many times. The current test that is available, that is valid, that is reliable, is the PCR test. All it would do would tell you at the day of entry, whether or not you were positive or negative, but it would not tell you what happened the day after that or the day after that. That is why quarantine is so important. I'm not convinced about putting everybody into a single location to quarantine them. There has to be a rights question involved in that, but I'm also mindful of the experience in Melbourne, who Australia does do that, and actually the major outbreak that led them to close down that city started in one of those hotels that they used to put inbound travellers into quarantine. And in terms of a decentralised strategy, actually our Test and Protect strategy is built from the ground up. It's built from those local health protection teams, those local incident management teams that look at the themes that are emerging as Test and Protect identifies the index cases, the contacts, the connections between them all, and so on, and makes decisions accordingly. So we have that decentralised approach, but equally, you have to have a national approach and a national framework that people can be accountable for.
Question number 4, Claudia Beamish.
Thank you, Presiding Officer. To ask the Scottish Government what measures it is taking to restore chronic pain treatment services in light of the official statistics for the quarter ending the 30th of June 2020, which recorded that over half of new patients waited over 18 weeks for a first appointment.
Joe Fitzpatrick.
I appreciate how difficult postponement of treatment has been for people with chronic pain. We remain committed to ensuring a full range of specialist pain services are resumed by health boards as quickly as it is safe to do so. Tomorrow, we will publish a recovery framework for pain management services, and as part of this, the Cabinet Secretary for Health and Sport will write to NHS boards to set out our expectation that they take immediate action to ensure pain clinics are prioritised alongside other essential services as we remobilise our NHS.
Claudia Beamish.
I thank the Minister for that answer, which is very encouraging, and that there will be immediate action, because many chronic pain patients have suffered without specialist pain relief for up to 6 months, some in my own region, since the Scotland's NHS clinics halted, and some have had to seek relief in England and pay for their treatment, which of course isn't possible for everybody. Those in excruciating pain are desperate to regain the services. So can I highlight, please, that, from what the First Minister said, it was that to reduce long-term reliance on specialist services and treatment, which the government claims, I quote, demonstrate limited health outcomes. Could the Minister highlight what limited means in this case? Some get 6 weeks or many months of relief from agony, and what treatments will be targeted? Were any charities consulted in what I recognise as an important step forward with the announcement tomorrow? Patients are concerned, and it would be much value to hear whether the lignocaine infusions and injections would be at risk on this list of limitations. Thank you.
Can I ask the Minister, please, just to stick to answering the questions and not respond to the preamble?
Sorry, I'm mixed up in terms of what was question and what was preamble now. The member makes a number of very important points. I think one of the questions that the member asked was about consultation with the organisations that represent stakeholders, and she's absolutely right. It is really important that we are hearing from those organisations, and it's very important as we take the Recovery Pain Management Framework Service forward that we're doing that while hearing the voice of lived experience. So really, really important point. The Recovery Framework for Pain Management Service will clearly set out the government's expectations that health boards will take immediate action to ensure people with chronic pain have access to the support that they need to improve their quality of life and well-being. So I hope the most important thing that I've said in that answer was about the voice of lived experience and the fact that we have consulted very closely with those organisations that represent the people who are suffering from chronic pain.
Supplementary from Emma Harper.
The impact of COVID and lockdown will undoubtedly have been difficult for anyone who's suffering from chronic pain. Can I ask the Minister if he can provide an update on the Modernising Patient Pathways programme and how this will be factored into the Scottish Government's NHS remobilisation plan, prioritising the resumption of some paused services?
Joe Fitzpatrick.
Yes, the Modernising Patient Programme, MPPP, has been closely involved in working with health boards to offer support to help remobilise and redesign patient pathways during the pandemic. So that will include supporting triage processes to ensure people are on the right treatment pathway for their needs. As part of our wider efforts to remobilise and redesign pain services, the MPPP is to fund a number of projects across Scotland to explore the provision of skilled pain practitioners in primary care and improve access to pain management support. And that will help to reduce demand and relieve pressures on specialist pain management services to allow for prioritisation of those most in need. So I hope that the member and other members in the Chamber see that not only am I determined that we will take immediate action, that we are also looking at how we can take longer-term action to improve the overall support that people with chronic pain receive.
Question number 5, Fulton McGregor.
Thank you, Presiding Officer. To ask the Scottish Government what financial support it has put in place for NHS dentists during the COVID-19 pandemic.
Joe Fitzpatrick.
The financial support that this Government is providing NHS dental practices and individual contractors during the COVID-19 pandemic is both unprecedented and is greatly contributing to the continuity of NHS dental service provision in Scotland. The Scottish Government is making exceptional payments of £12 million per month to support NHS dental practices specifically. This includes additional investment of £2.75 million per month to support practices with running costs and mitigate lower numbers of patients due to the current public health measures that are placing restrictions on patient volume.
Fulton McGregor.
I'd like to thank the Minister for that response. I've been contacted by a number of constituents who have advised me that they've been unable to get dental care through their NHS dentist. They've been advised to seek the treatment privately, but in some cases can't afford this. Can the Minister advise if the Scottish Government have plans to allow NHS dentists to carry out the same level of treatment that private practices are offering, while of course keeping all patients safe from COVID-19?
Joe Fitzpatrick.
Thank the member for his question. I think it's probably first important to point out that all throughout the pandemic, in Scotland we have ensured that there has been a strong network of NHS provision for urgent dental care. I think second and there was nothing similar anywhere else, as I'm aware, in the UK that provided that level of access for urgent care. But clearly a number of people have indicated that there appears to be a difference between what is available in terms of private and NHS dentistry. And I want to maybe put some context around that, to the difference between NHS and private dentistry. Dentists who perform NHS work are regulated primarily by their local NHS Health Board. Private dentistry is regulated by Healthcare Improvement Scotland. But whether carrying out NHS work or working privately, all dentists are subject to the same requirements to control the spread of coronavirus. The Health Protection Coronavirus Restrictions and Requirements Scotland Regulation 2020 requires all healthcare providers to take all reasonable measures to ensure safe practice in the controlled environment that they are currently operating. There is, of course, scope for different practices to take slightly different approaches to meeting the same requirements, depending upon the nature of their practice premises and their individual situations. But these measures may necessarily include strictly limiting the number of patients seen each day. But let me be clear that the most sensible way of ensuring compliance is that all dentists should comply with the dental remobilisation plan, whether they are private or NHS. And clearly, within that plan, we are continuing to look at how and when we can further increase the range of treatments that are available on the NHS.
Can I have a quick supplementary, please, from Rhoda Grant?
Yes, just following on from that answer. That doesn't really answer the question as to why someone at the same dentist can be refused NHS treatment, but then be offered the same treatment privately. I have a constituent who has paid well over £1,000 for fillings for a child at the same dentist because of the lack of PPE for NHS patients.
Joe Fitzpatrick.
Let me be absolutely clear. There is appropriate PPE made freely available for NHS dentistry across Scotland, but clearly to do that, it has to be for NHS dentistry in line with the remobilisation plan and in line with the guidelines of the Chief Dental Officer. And I would encourage all dentists across Scotland to look at the CDO guidelines, follow those guidelines. The CDO is working really hard with BDA and others to look at how we can remobilise all of dental services right across Scotland in a way that it is safe to do so. But the suggestion that there is not enough PPE is, quite frankly, not factual.
Question number 6, Claire Adamson. We seem to be having a problem getting Claire Adamson connected. So we'll move on to question number 7, John Scott.
Deputy Presiding Officer, to ask the Scottish Government what recent discussions it has had with NHS Ayrshire and Arran regarding measures to control the spread of COVID-19.
Jean Freeman.
Regular meetings between, in fact weekly meetings between the Chief Executive of the NHS Scotland and senior officials and Chief Executives of our NHS boards, including Ayrshire and Arran. In addition, the Minister for Public Health and I meet board chairs on a fortnightly and monthly basis, and the Chief Executive of Ayrshire and Arran is on the recovery group for the remobilisation of NHS, which I chair. In all of these meetings, aspects of our response, our preparedness and our planning for the pandemic is discussed.
John Scott.
Thank you, Deputy Presiding Officer, and I thank the Cabinet Secretary for her answer. And she will be aware from these meetings of the growing concerns of family members who are having difficulty accessing elderly relatives in care homes, particularly in Ayr constituency. As Dr Donald McCaskill has observed, the longer we keep people apart, the more people will be lost to our COVID response rather than the disease itself. And my constituents are suffering from this. What can the Cabinet Secretary do about this unfolding tragedy in Ayrshire and elsewhere?
Jean Freeman.
So I'm very glad that Mr Scott has asked me that question, because there are a number of points that I need to make. First of all, we already have 40% of our care homes who meet the criteria, which is they have to be COVID-free for 28 days and they have to take part in the care home staff testing programme. 40% homes who meet that criteria already have indoor visiting. Outdoor visiting remains. But I actually spoke to Mr McCaskill and the Care Inspectorate this morning. I have fortnightly meetings with both of them. And when I was speaking to Mr McCaskill, I raised with him my concern that I too am receiving emails from a number of family members telling me that their care home has now stopped all visiting and that they are saying that they've stopped it as a requirement of the Scottish Government. Nothing could be further from the truth. I have asked him to make that clear to all his members, and I intend to write to all care homes, as I did before around the question of testing. I intend to write to them all again to remind them that the restrictions introduced yesterday do not impose additional restrictions on care home visiting. On the contrary, part of what we are trying to do with what the First Minister said yesterday is not only keep education open, but protect and keep our care homes open to visiting. I also had the benefit of a discussion last Friday. I will discuss with this group again this week or early next week. So my discussion was with the Care Home Relatives Facebook group about how we could increase indoor visiting in terms of time, length of time you can visit and frequency for the designated indoor visitor. And we are actively looking now with our clinical and professional advisory group to make sure and to see how we can do that, because I do want to be able to do that, how we can do that in a way that continues to protect the residents. Of course, that's our primary objective, but also ensures that we can allow those family members to be with their loved ones for longer, to eat with them, to have a kind of normal visiting as close to that as we can possibly manage. So that work is all underway, as of course is the work to reintroduce to our care homes health and personal care services and also outdoor visits, both of which had been paused during the pandemic.
Question number 8, Dean Lockhart.
Thank you, Deputy Presiding Officer. To ask the Scottish Government what support it's giving to small community-based football clubs that are facing financial difficulties and closure due to the COVID-19 crisis.
Joe Fitzpatrick.
The Scottish Government has been working closely with the footballing authorities to ensure clubs at all levels have access to the support and advice they need at this difficult time. Since the start of COVID-19 outbreak, the Scottish Government has worked closely with the UK Government and private and public sector partners to develop a range of support mechanisms for business. As well as this, the Third Sector Resilience Fund is a £20 million emergency fund for charities, community groups, social enterprise and voluntary organisations working in Scotland. The fund supports organisations that already deliver services and products but find themselves in financial difficulty directly as a result of the pandemic. The primary intention of this fund is to help third sector organisations to stabilise and manage cash flows over this difficult period. In order to safeguard our wider sporting sector, I've written to the UK Sports Minister to request an urgent meeting to discuss the possibility of a recovery package for sport.
Dean Lockhart.
I thank the Minister for that response. For community-based sports clubs, the return of ticket-paying fans is now, for understandable reasons, a distant prospect. Many of these clubs, such as Stirling Albion in the area I represent, are facing challenging times, both financially and operationally. Will the Scottish Government now consider taking additional non-financial measures to support these clubs? This could include helping with health risk assessments to identify how clubs can use their premises for other purposes, assistance with live streaming matches to local communities, and helping to explore alternative sources of revenue to help ensure that these clubs, which are very often at the heart of their communities, are able to survive the crisis.
Joe Fitzpatrick.
Thank the member for his very constructive question there. I do think it's important that we do all of these things, and these are areas which my officials working closely with the SFA in particular and the SPFL. But I think all of the things that the member suggested are things which I think are being looked at. I've certainly heard a fair bit about the concept of streaming tickets, for instance. So I think some clubs are really seriously looking at this. But he's absolutely right about the challenge this places on our clubs, which is why I have, in the same spirit of cooperation, written to the UK Sports Minister to see if across the four nations we can work together in order to support what is certainly for some people and for many people the heart of their community.
That concludes questions on the health and sport portfolio. Just a wee note for members. That was almost a full half hour and we only got through 7 questions. So can we have a think, please, about how we ask our questions and indeed the length of the answers. And we will move on to the next item of business. People will organise. Please take care to maintain social distancing when leaving the chamber.